Thank you for choosing RXNT's cloud-based electronic health record software for your practice. Our intuitive functionality will simplify workflows, reduce administration, increase practice security and data access, and improve patient care. Enrolling is quick and straightforward. Allow yourself a few minutes to watch this video before you begin. And if you have a question, please reach out to one of our support representatives at 800-943-7968. Your enrollment begins at the pricing page of our website. Select Enroll Now on any of our affordable software plans, or select the integrated functionality of our comprehensive full suite bundle and save versus individual products. Looking to save even more? You'll get 10% off when you select an annual plan for most solutions. Next, choose the number of licenses you'll need for your practice. Select Add, and then Continue. You'll be automatically enrolled in our electronic prescribing for controlled substances feature. If you don't prescribe controlled substances, just select Remove. If you're interested in adding emails, reminders, or e-faxes to your EHR software, you can do so here. Several add-ons are available free of charge. When you're ready, click Continue. Next is the subscription summary, which acts as your cart and outlines your selections and costs. If it looks good, click Continue. On this screen, you'll enter your user, organization, and payment information. There are a few important things to keep in mind here. Complete this section with your personal user information for the company's organization details. Double-check the email and password you enter on this screen, as you'll use them to sign into our client login after enrolling. Please make sure to take note of and remember this information. A confirmation email will be sent to the email address you entered. During this step, you're establishing your login credentials. Your username must be a unique email that's not used by anyone else in your practice. As you scroll down, you'll enter payment information. Connect a bank account or pay with a credit card. This can be a personal card or a company card and can be changed in the future. Review the terms of service, and once you've accepted, click Get Started. You'll be automatically redirected to the RXNT dashboard. In case you don't find yourself at this screen, go to rxnt.com, select Client Login in the top right, and enter your login information. If you're a provider, check the I am a provider box and your information will be pre-filled from the previous step. You can complete identity proofing to validate practice credentials. If you are not a provider, please proceed to add the information for a provider within your practice. However, the provider will need to complete identity proofing to validate the legitimacy of your practice. Remember, the email address will serve as a username to log into our system. If you're a practice admin completing this on the behalf of a provider, it's important to use the provider's email here. Complete the rest of the fields and click Continue. Next, the provider will receive an email directing him or her to complete ID proofing. The ID proofing step must be completed by the provider. Be sure you have easy access to the phone number entered into the provider profile, since a verification code will be sent to this number. Here's an example of what the email will look like. If you don't receive the email, go to rxnt.com, select Client Login in the top right, and select Forgot Password. Click Create Password. You'll receive a text to the phone number you added in the previous page. Enter the 6-digit code. Then click Validate. Next, you'll see the ID proofing screen. It's an easy process, but if you need help, be sure to check out the FAQ guide. After reading the agreement, select I agree. Next, enter the required information. Keep this information handy for easier entry. Social Security number, date of birth, driver's license number and state, phone number, address, and credit card information. Don't worry, your credit card won't be charged. Your card number is needed by Experian, the ID verification company, to cross-check your information and make the proofing process easier. If you're not comfortable including this information, it is not required. Before you click Next, double-check that all your information is accurate. Otherwise, it will slow down the ID proofing process. On the next set of screens, for security purposes, Experian will ask you a few verification questions that only you should be able to answer. Complete the next 2 screens and click Submit. If you'd prefer, a practice administrator can complete the rest of the process. Simply click the Don't Have Time button to hand off enrollment to someone else. If you plan to continue enrollment, click Proceed. Next, you'll enter information about your organization, including information about billing services if you use them. You're also able to add other locations and appointment details. Click Continue. The provider that you have just enrolled will be listed as incomplete. By default, the first provider you enroll will be given the billing contact and practice administrator roles. To finish setting up, click Continue. Since you've already filled in most of this information, we'll skip to assigning a product. In this section, you'll select the products and add-ons that should be available for each license. Choose the products you want, then hit Add. This will link these licenses to your account, or the account of the provider if you are a practice administrator. If you've chosen to add electronic prescribing for controlled substances, you'll need to scroll down and add DEA details here. You'll need a DEA number, as well as an image of the DEA certificate. Next, complete the prescription details. Click to download the signature form, print and sign it. Then scan the form or take a photo, save it to your computer, and upload it here. Please note, you'll need to upload an individual provider signature form for each provider. If appropriate, assign or remove a role from this provider. Please note, there must be at least one billing contact on the account. The next screen will show your account status as unverified. That just means that the ball is in our court. We'll take it from here to process your enrollment and change your status to verified. Here's where you can also enroll other providers in your practice. Select the button in the top right corner and enter the information for the new provider as you've done before. Once your enrollment is verified, a project coordinator will be assigned to your account. Within the next business day, they'll be in touch to set up a kickoff call in your training. Remember, if you get stuck or have any questions along the way, give us a call at 800-943-7968.